Nitin. Good afternoon, everyone. As we all witnessed recent incidents in our court premises, one was the youngest advocate. We could reach in time. As there was a sign of pain in his chest, we could reach in time and take him to the dispensary. From there, within golden hour, we could get him the treatment and save one life. Thereafter, we have seen another senior advocate. Unfortunately, we could not save our senior colleague. Considering the exigency in the need of this subject, our Honorable President opined to get all the equipment in place along with the knowledge required. As part of the endeavor, we today invited Dr. Vijay R. Boinpalli, Doctor of Medicine from United States of America. May I now request our Honorable President, sir, to take over the proceedings. Yeah. I request our Vice President and Brother Secretary Sanjeev to felicitate the Honorable guest by presenting a bouquet and the shawl. May I now request our Honorable President, sir, to introduce the doctor guest speaker.
Good afternoon. Friends, we thought it fit to invite an expert doctor to demonstrate before us how to use CPR and the machinery connected with it. Dr. Vijay B. Rao, he had completed his MD in USA. Incidentally, he is my neighbor this day and I know him long time, but it has taken time to invite him here. Dr. Rao had a number of, his credit, he had conducted a number of camps to train individuals as well as the hospital staff. To name a few, his experience, I will not take much time. The doctor had suggested me that it's a big thing to read. So therefore, I just keep before you the experience he had. From January 2007, AHN training centers in India, he had conducted ACLS, BLS, lead instructor and course director, faculty professor. He had worked in various capacities as instructor in American Heart Association, NTR University of Health Sciences, and Resurrection Healthcare Training Center, Chicago, Illinois. He had also conducted in the Indian Institute of Emergency Medical Services, Kottayam, Kerala, India, and also his credit he had conducted in George Washington University, Washington DC. He had academic affiliation as faculty for Osler's Academy, a part of Innovate Medical Center, Madhapur, Hyderabad. He had faculty affiliation with Phoenix Institute of CPR and Defibrillation, New Delhi, for BLS and ACLS programs. Was professor of Resuscitation Medicine at Global Medical Education and Research Foundation, Hyderabad. And I now request Dr. Vijay Ravan, please demonstrate. Please demonstrate.
Thank you, President Garu, for inviting me to this honorable gathering. And I am now going to demonstrate and talk to you about CPR and AD. Unfortunately, in the last 1 week, 2 advocates have passed away. One advocate in the High Court and one advocate in a bank in Westmar Italy. And I think it's the need of the hour for all the advocates to learn about CPR and AD so that a precious life can be saved. I'm sorry. Yeah. So the need of the hour is for all the advocates to learn about CPR and AED so that they can save a life during a cardiac arrest situation in the courtroom and also in their offices. Now, I've been told that all of you have been told about CPR and AED at other hospitals. Today, the main focus of my speech and lecture will be about the AED, automated external defibrillator. The two advocates who passed away due to sudden cardiac arrest. Now, in the press, it has been reported that it was a heart attack. There is a difference between heart attack and cardiac arrest. It is like apples and oranges. Apples and oranges are both fruits and they are both circular. But there is a lot of difference between a heart attack, between an orange and an apple. Similarly, heart attack and sudden cardiac arrest are two different entities. Whenever there is a heart attack, the patient will complain of chest pain. For example, Venugopal Rao Garu, who passed away last week in this High Court, had he sat down in the chair and had he said, I'm having chest pain, then it would have been a heart attack. But in this case, he suddenly collapsed. So it is a sudden cardiac arrest. As I told you, there is a difference. In heart attack, the patient will have a pulse, he will be breathing, and he will be responsive. He will be sitting in a chair or he will be sitting by the side and he will be saying, "Na gunde noppi vastundi, na gunde noppi vastundi." So that is called a heart attack. All heart attacks might lead to cardiac arrest, but all cardiac arrests are not due to heart attack. So that is one important thing you have to remember. Whenever there is a heart attack, when the patient starts complaining of chest pain or diaphoresis, which medically is the name for sweating, or he complains about some giddiness and nausea and sick stomach, those are all premonitory symptoms of heart attack. And most of the heart attacks are due to ischemic heart disease. Ischemic heart disease or coronary artery disease is the leading cause of heart attacks. Now, cardiac arrest, on the other hand, is due to an electrical failure of the heart. Heart attacks are most arrests will also occur due to an electrical failure in the heart. As I told you just 2 minutes ago, when there is a heart attack, it is due to the mechanical failure. The heart's muscles are not working properly. They are having pain. So that's why it is reflected as pain or sweating. So whenever there is a heart attack, you need to call the emergency response system or you need to call the local hospital emergency room and say that there is a victim of heart attack. So in those situations, they will come with all the necessary equipment and then they will treat the patient and take to the nearest CCU or ICU. Cardiac arrest, on the other hand, sudden cardiac arrest can occur at any time, anywhere. I started this lecture about 5 minutes ago, about 10 minutes ago. Within the span of this 10 minutes, 5 people have died throughout the world due to sudden cardiac arrest. Every 90 seconds, there is a sudden cardiac arrest all over the world. Every 90 seconds. And it's not a laughable matter, it's a very serious issue. As I'm saying, every 90 seconds. Now, I have been talking to you for the last 7 or 6 minutes, and in this time, almost about 4 people have died due to sudden cardiac arrest around the world. So, cardiac arrest is due to electrical failure in the heart. Whenever there is a mechanical failure and electrical failure, and the heart is completely stopped, if you recognize it immediately, how do you recognize sudden cardiac arrest? There won't be breathing, there won't be pulse, there won't be any response. So immediately you have to do the CPR, cardiopulmonary resuscitation. Now I have been told that most of the advocates of this association have been trained in CPR at a nearby hospital. So today my focus is going to be on the AED. Why do you do the chest compressions? Because there is a mechanical failure of the heart. Why do you give a current shock to overcome the electrical failure in the heart? Now the heart works due to a muscular action, which are the muscles, and due to an electrical activity called the rhythm of the heart. When the rhythm has completely stopped, then you have to give a counter shock. The counter shock is given by an instrument called the AED, Automated External Defibrillator. There was a doctor by name Frank Pantridge in Northern Ireland, in Belfast. He first came up with this technological advances in AED and started the first AED. This was way back in 1964. Since then, a lot of technological advances have taken place throughout the world in the field of resuscitation. And presently, the AEDs are available in Western countries at public places like malls, multiplexes, airports. I worked in Western countries. I worked in the US for 11.5 years. There, the AEDs are available at public places like malls, multiplexes, airports, so on and so forth. This is called a public access to defibrillation program. Here in India, the awareness level is only 2 to 3% about CPR and AED. I am making my own efforts to create more awareness about CPR and AED so that precious lives can be saved in critical areas. Recently at Vishweshwaraya Bhavan in Khairatabad, one young politician who came all the way from Kerala, he was also giving a lecture. It was reported widely in the media. He was also giving a lecture at Vishweshwaraya Bhavan, and he suddenly collapsed due to cardiac arrest. Unfortunately, at Vishweshwaraya Bhavan, there was no AED available. Had they done CPR and used an AED, his life would have been saved. When you do CPR and you use the AED within the first 6-7 minutes of cardiac arrest, 80% of the lives can be saved. So remember, mechanical failure can be overcome by chest compressions. The electrical failure can be overcome by the AED, Automated External Defibrillator. So there is a need for public access to defibrillation in India also, like at malls, multiplexes, airports, high courts, banks. If you keep an AED and if you retrieve it and give the counter shock immediately, lives can be saved. Now I am going to give a demonstration of the AED, which is called Automated External Defibrillator. And this can potentially save a life if it is used within the first 5-6 minutes of cardiac arrest. Whenever there is a cardiac arrest, there is two malignant rhythms are possible. One is ventricular fibrillation and the other is ventricular tachycardia. I will not go into the details of the arrhythmias because it is for the cardiologists and it is for the doctors. At your level, you need to understand that whenever there is a cardiac arrest and a mechanical failure and electrical failure, it means that there is a ventricular fibrillation, and that can be overcome only by using an AED. Within the hospital, you have manual defibrillators. Since there is a cardiac arrest situation in the High Court, you can't go to the hospital and bring the manual defibrillator. So that's why eminent doctors like Frank Pantridge have come up with the concept of AED, Automated External Defibrillators. And these automated external defibrillators are user-friendly. You don't have to be a doctor, you don't have to be a nurse, you don't have to be a paramedic, you don't have to be a medical student. Any Tom, Dick and Harry, any lay person can use the AED. And AED stands for Automated External Defibrillator. I'm trying to log in with various government agencies and medical agencies in India to create awareness about AED. Now I'm going to demonstrate how to use an AED. I request one of the doctors, one of the persons to stand here. So this is called an AED, Automated External Defibrillator. As I said, you don't have to be a medical person to use it. The first thing to do is don't get panic. Don't be panicky whenever there is a cardiac arrest situation. Be calm, composed, retrieve the AED and then press it on.
Apply pads to patient's bare chest.
It says apply pads to the
connector next to
bare chest. And these are the pads. So you apply these pads.
Apply pads. Plug in connector.
This is the pads connector. ఏం కాదు భయపడుతుంది.
The patient.
Analyzing heart rhythm, do not touch the patient. When it is analyzing the rhythm, you should not touch the patient.
Charging. Stay clear of patient.
Stay clear.
Deliver shock now. Press the orange button now.
When it says press the orange button,
Shock delivered.
you have to press it, the shock is delivered. Now
CPR.
in this case, it is only a demonstration model, therefore the shock is not delivered. This is only for representational purposes. But in a real life situation, it will deliver a shock, and 80%, trust me, if you do CPR and AD, 80% of the lives can be saved. Now what is the importance of defibrillation? It delivers a counter shock to the heart, because whenever a person falls down to cardiac arrest, the most important arrhythmia that's taking place in the heart is called ventricular fibrillation. To overcome the fibrillation, you have to defibrillate the heart, and this is an automated one, and there are manual ones also. There is a Durushawar hospital nearby here, Princess Durushawar Hospital. I used to work as the intensivist in the ICU. I saved 3 lives with the manual defibrillator, not the automated one. I saved 3 lives in the ICU, but one patient succumbed the next day, but 2 other patients have survived. So there is a difference between hospital defibrillation and outside the hospital defibrillation. The one that is done in the hospital is called manual defibrillation. The one that is done outside the hospital is called automated external defibrillation. Lot of studies and lot of research have taken place since the first AED was used in Belfast in 1964, when Frank Pantridge invented the AED. The latest AEDs are biphasic. So what happens is, the current flows in both directions in the biphasic ones. The earlier ones were monophasic. Current used to follow only in one way. But now with the latest advent in technology, the current flows in both the directions. These are biphasic ones. They deliver a shock of 200 joules. 200 joules to overcome the electrical activity in the heart. So this is called an AED. I urge all of you to get an AED and place it in the court premises, because if the next time there is any cardiac emergency like a sudden cardiac arrest, you can retrieve it. The first thing is you have to be calm. Retrieve the AED and give a shock within the first 5-6 minutes of cardiac arrest along with CPR. So lot of studies have taken place, and the most important studies took place at Duke University in North Carolina. So I urge all of you to, be a part in this campaign in India to give public access to defibrillation, and maybe we can save precious lives. They should be placed at all critical places in the city of Hyderabad. Thank you. If you have any questions, you can ask me.
Please speak about CPR also.
Yeah, cardiopulmonary resuscitation is the mechanical skill which you perform whenever there is a cardiac arrest. So what you do is, I was told that you already had a demonstration of CPR in one of the regional hospitals. That's why I did not bring the mannequin. I got the AED. And CPR is cardiopulmonary resuscitation. And it was started way back in the late 1950s and early 1960s. There was a Dr. Peter Sapar, who was an anesthetist from Austria. He immigrated to the US, and he first started his skills at the Baltimore City Hospital in Baltimore in US, and also at the University of Philadelphia in Philadelphia, Pennsylvania. He first started his skills, and later on these skills were accepted into clinical practice all over the world, and now it is the standard of care during a cardiac arrest situation. So how do you do CPR? Whenever there is a cardiac arrest situation, you call the emergency response system immediately. First call the emergency response system, then go near the patient, kneel beside the patient, and do chest compressions. You do chest compressions with the thumb, with the heel of your hand. Hit a button. So, if you are walking on the high court road nearby, and you suddenly see somebody collapsing, the first thing that you have to call is the local emergency number, or in the Hyderabad, you call the 108 number. Nationwide, you call 112. It
is the emergency number, and then you go to the victim, and when you sit beside the victim, this is the heel of your hand, you place it in the center of the chest, and you hold the other hand like this, okay, and you do the chest compressions. How do you do the chest compressions? You press hard and fast, push hard and fast in the center of the chest, lower part of the breastbone. You press to a depth of at least 5 centimeters, and you compress at a speed of 100 to 120 per minute, 100 to 120 per minute. And how long will you do it? Until the patient starts coughing, breathing, moving, talking, or the pulse comes back, or until the ambulance comes onto the scene. Once the ambulance comes onto the scene, they will do the next steps of recognizing what rhythm it is. They'll connect the patient to the monitor and see what cardiac rhythm there is in, and they will give drugs, whichever drug is appropriate for the cardiac rhythm. They might give IV medications like atropine or epinephrine, or they might give amiodarone, which is a cardioverting drug. So that is for the ambulance people. But you have to do these compressions until the patient starts coughing, breathing, moving, talking, or until the ambulance comes to the scene. Or if you get fatigued, you can ask the next person to do the CPR. Thank you. So this is how you do CPR. And then when the ambulance comes onto the scene, they will ferry the patient to the nearest hospital. And the hospital doctors will take it over from here. So this is about CPR and AD. If you have any questions, I'll answer them.
Precautions. Any precaution was put in? Any precaution?
Yeah, you can get it. But that is for the cardiologist to do in an ambulatory setting in the hospital. This is a cardiac arrest situation where there is no pulse, no breathing, and no response. Okay? There is no pulse, no breathing, no response. When you do the angiogram and ECG, that is in the hospital. Yeah. So, as I told you, sudden cardiac arrest can occur anytime, anywhere, due to electrical failure in the heart. Anybody can collapse anytime. Every 90 seconds, there is a death due to sudden cardiac arrest throughout the world. We have been talking for the last 15-20 minutes. Already 10-12 people throughout the world have expired. The treatment for sudden cardiac arrest is CPR AED. CPR AED. And you have to do the chest compressions until the patient starts breathing, coughing, moving, talking, or until the ambulance comes back, or until the pulse comes back. Or if you are tired, you have to ask the next person to do the CPR until the local ambulance service sends the ambulance to the scene of action.
What is the price of?
Yeah, I'm told that the price of an AED is somewhere around 1.15 or 1.2 lakhs within this country. And I'm not a businessman, I'm an academic professor. So I'm only talking about the importance of the AED. You can put it up, look it up in Google, and you can ask any one of the biomedical companies to supply one to you. And it should be placed at a central location. And whenever there is a cardiac arrest situation, don't panic. Don't panic and run from helter-skelter from here to there. Just go to the AED and then bring the AED, switch on the AED, then put on the pads, analyze the rhythm. If the machine advises to shock the victim, press the orange button. That's what you do. So remember 4 steps. Power on, attach the pads, analyze the rhythm, shock the victim. PAS, P-A-A-S. Power on, attach the pads, analyze the rhythm, and shock the victim. If you remember these 4 universal steps, you can use an AED anywhere in the world. You don't have to be a healthcare professional. Even a lay person can use it. In Western countries, these AEDs are available at public places, and there is a display in the local language as to how to use the AED. అదే చెప్తున్నానండి, సడన్ గా ఎక్సర్సైజ్ ఎలక్ట్రికల్ ఫెయిల్యూర్ అయితే సిపిఆర్ చేయాలి, ఏఈడి కూడా ప్రివెన్షన్. ద అమెరికన్ హార్ట్ అసోసియేషన్ says if you walk 5 days a week for 40 minutes, then it can be a lifestyle change. But that in itself does not cause cardiac arrest. Cardiac arrest can occur anytime, anywhere. 80% of the sudden cardiac arrests are due to ischemic heart disease or coronary heart disease. Then another 15% is due to cardiomyopathies, where the muscle gets enlarged genetically and then the patient dies. And then in the last 5% is due to inherent genetic problems like Brugada syndrome, Wellen syndrome, long QT syndrome. These are all genetically they occur in the body due to a mutation in the genes, and that's how they occur. So 80% is due to ischemic heart disease, another 15% is due to cardiomyopathies, and the other 5% is due to these genetically inherited conditions. And a lot of importance has to be given to this so that we can save precious lives.
What precautions should we take? Heart disease, so that we don't get heart disease.
That is ischemic heart disease, sir. Ischemic heart disease or coronary artery disease is the same. Lifestyle modifications. Now, this is not a lecture on coronary artery disease and ischemic heart disease. This is only a demonstration of CPR and AED during a cardiac arrest situation. A cardiac arrest, as I told you, occurs suddenly due to electrical failure. Now, few days ago, another lawyer succumbed to sudden cardiac arrest at a bank in West Maripalli. Now, had the bank had an AED and had the bank staff been trained in CPR and AED, had they used the AED, there was an 80% chance that his life could have been saved. So I request you, all of you, to place these AEDs in locations where there is a lot of public activity, like malls, multiplexes, apartment complexes, courtrooms, and banks. These are all critical areas, and if you place an AED, it can be retrieved from a central location and it can be used on a victim of cardiac arrest.
In general, you please say like how to prevent these kinds by changing our lifestyle, like
The lifestyle change is for ischemic heart disease.
That's what.
Coronary artery disease.
That's what.
And 80% of the cardiac arrest, sudden cardiac arrest are due to ischemic heart disease.
So what are the preventive measures? Like
For ischemic heart disease, as I told you, you can go to any primary care physician. The way you can prevent ischemic heart disease is by lifestyle modifications. Exercise regularly for about 40 minutes walk, at least 5 days a week. That's what the American Heart Association recommends. And then you can also do other lifestyle changes like leading a stress-free lifestyle, having a stress-free life, balancing your work with your family well-being. And you can also decrease on your salt intake if you are a patient of hypertension, and then maintaining your sugar levels. So these are all important ways you can decrease the incidence of coronary artery disease.
While I'm driving the car, four-wheeler, suddenly anything happens to me. Well, I go to
There
how to save myself.
You have asked a good question. Some studies have been done, and most of the ones that you see on the internet, they say that you can do CPR on yourself. Particularly, this came up from the University of Rochester in New York City, near New York in US. And they say if you cough deeply, then it causes the compression, and you can cough deeply and then press. It will stimulate the electrical activity in the heart, and by pressing your chest against the steering wheel, you can you are doing the compressions. But many studies have said that this is not approved by the American Heart Association, so nobody actually follows it.
So suddenly anything happens and while I'm driving the vehicle car, can I stop the car in there or
You go to the side and call the nearest emergency number. There have been some stories. There was a James Bond movie called Casino Royale. I don't know how many of you have seen that Casino Royale movie by James Bond. Daniel Craig acted in it. He's playing in the casino, and suddenly the villain poisons him, gives him poison, and to save his own life, he goes to the car, and then he does ventricular fibrillation on himself. But those are all, fictional accounts of how you can save your own life. In real life, in India, nobody calls the ambulance, does it on himself. Here in India, we have to depend on our local emergency services. In that movie, Daniel Craig, James Bond, he goes to the car and then he calls the MI5, the emergency their intelligence chief, and she says, take it out from the car, there is something on the car bonnet or something, and put the paddles on yourself and then press this button. So he shocks himself and then he comes out and again defeats the villain. So those are all fictional stories. It can't be done in real life. In that case, he actually does defibrillation on himself.
Doctor, my question is, what is the effect of these tablets, ecospirin, clopid, and sorbitrate?
They are all treatment for ischemic heart disease. Ischemic heart disease.
So do
coronary
we
artery disease.
carry them in the pocket,
Yeah.
and as and when we sense such a attack or something ailment,
Yeah.
can they help us?
Those are helpful in ischemic heart disease, coronary artery disease, and it can be even given by any paramedic, doctor or nurse. So they have no role in sudden cardiac arrest. I have come here to talk to you about sudden cardiac arrest and CPR and AED. The drugs that you are mentioning are used for the treatment of ischemic heart disease, where the patient complains of pain. In sudden cardiac arrest, nobody complains of pain. They suddenly collapse just like that. These drugs that you mentioned are used for ischemic heart disease.
So is that good for precautionary carrying?
Yeah, it's good to carry them, and whenever you feel some chest pain or something like that, you can take the medicines or call the local emergency number.
Thank you.
Thank you.
So for immediate prevention of heart attacks, when we experience a heart attack for a person, should we keep the tablets ready?
Yeah, you can keep the tablets ready and you can call the local emergency number or the
The
local
person
ambulance.
complains of chest pain.
Yeah.
So we can administer the tablets.
Yes, you can, provided it is due to ischemic heart disease or coronary artery.
That we cannot
They are
take
both,
out.
yeah, they are both synonyms. Ischemic heart disease and coronary artery disease, both are synonyms for the same condition. So he will be experiencing pain and there will be a muscle
The
failure.
first and foremost thing would be we should call an emergency healthcare unit first.
Right.
So will not be in a position to identify whether this is because of that or this.
Yeah, the way you identify sudden cardiac arrest is if you see no response, no pulse and no breathing, then it is sudden cardiac arrest. If the patient is having a pulse, if the patient is breathing and if the patient has got response, it is heart attack, not cardiac arrest.
And we have to take it to the nearby
Nearby
dispensary.
medical personnel and
Thank you, sir.
percentage of chances when you do CPR
Yeah.
or with this
Very good.
electrical?
Very good question. I'm glad that you have asked me this question, and I also know that you are listening to what I am saying. If you do routine CPR on the roadside, then the survival chance is 10 to 12%. 10 to 12%. But if you do it within the first 5-6 minutes, just the chest compressions, then the life survival increases by doubles or triples. And if you use the AED and CPR together, then it is 80% survival. I'm glad that you have asked the question.
Is there any link between Covishield vaccine and cardiac arrest?
Yeah, there have been some studies, and it is no case of sudden cardiac arrest has been reported by COVID. It causes cardiomyopathy, inflammation, and such things are caused by COVID. There have been studies, but it does not cause sudden cardiac arrest.
Out of curiosity, I'm asking a last question.
Yeah.
Is it a myth? Is it a myth that the pressure will cause a heart attack, or it is a scientifically?
Yeah. See, heart attack, as I told you, is mostly due to ischemia. The heart muscle does not get adequate blood supply, and whenever there is a decrease in blood supply and you exert yourself, it manifests itself as pain, chest pain. Sudden cardiac arrest is sudden, immediately they collapse due to electrical failure in the heart. To overcome the mechanical failure, you are doing the chest compressions. To overcome the electrical failure, you are doing a current counter shock. So there is a difference between heart attack and sudden cardiac arrest.
Thank you very much.
Sir, I have a question. Does a heavyweight workout have an impact on heart?
Yes, heavy exercise without medical supervision can lead to cardiac arrest.
What about gymming?
Yeah, those are also. Recently in Karnataka also, some young actor has died due to sudden cardiac arrest. Yeah, during workouts. And also recently in Pune,
there were one or two cricketers died on the field due to sudden cardiac arrest, and they were almost consecutive, just within a span of 2-3 months. 2 cricketers have died. Those were all due to sudden cardiac arrest.
So what are the precautions that we can take to this kind of operation?
Yeah, see, making these are less expensive and they go a long way in saving lives, precious lives. Having an AD at all public places will go a long way in saving lives, and you also have to train the personnel in training. And as I told you, you don't have to be a healthcare expert. Even a layman can use this. All you have to remember is power on the AD, attach the pads, analyze the rhythm, and the machine will tell you what to do. The machine will tell you to press a button. You press the button and then the person can leave 80% of the time. 80%.
I have one question. In case of any minor children, last couple of months back, my friend's daughter, she is in 8th standard. She died with the cardiac arrest. What could be the reason?
It was cardiomyopathy. I can tell you now, it is cardiomyopathy. My own cousin's son, he was getting down from the stairs in the school. He was studying in the 6th or 7th standard. He also expired, and it was due to cardiomyopathy. These cardiomyopathies are genetic conditions in which the heart muscle is very much enlarged, and they cause fibrillation, which is the final common pathway to cardiac death. So they lead to ventricular fibrillation and the patient collapses and dies.
After almost a doubt, while I'm driving the vehicle, four-wheeler, already got stunned one time. I'm 65 years old. Suddenly, breathing tablets, can I keep any tablets? He said.
Yeah, you can keep your echospirin, blood and parcel blood.
Suddenly, I thought I was keep beside the vehicle.
In such cases, consult cardiologist. Certain see the difference if you
I
find
went
it.
Shastri, sir, Dr. Shastri, care hospital. He advised him. They must be
Wonderful, wonderful. Claps, big applause.
Thank you everybody. See, we have planned to purchase one for our association. I thought it fit on my behalf. I want to donate one to the association.
Let there be a request. Bhushan, let there be a request for support from the seniors.
Very grateful to you, doctor. It was really a life-saving knowledge, not only to ourselves, to our colleagues and loved ones. And we are thankful to our president, sir, for such a gesture. And I also request our association needs more kids like this, because it's our life, it's our welfare. So I request all the senior advocates to come forward and donate such kids so that we can have them at the maximum places to reach out to possible every court hall. That's a request from the association. And now I request our brother secretary to give vote of thanks.
Good afternoon. On behalf of the Telangana High Court Advocates Association, I deem it privilege to address vote of thanks. I thank Dr. B. Vijayarao for accepting our invitation and addressing the law. And I thank all the designated seniors, and also advocates, ladies and brothers and sisters, for attending this program and making it success. Thank you, Mandal. I am grateful to B. Vijayarao once again. Thank you. And Dr. also.
Thank you for giving me this opportunity.
We especially thank you our president sir giving